and he takes care of heroes every day. It takes a special person to do what he does. Every day he sees people with different hurts and scars. Small ones, big ones, complicated ones that never go away, and others that are invisible to everybody else. The scars aren't just on the outside. Sometimes, my dad says, people hurt more on the inside, and you can't see those scars. Those scars take a long time to heal. Where my dad works, they make sure to know lots about the veterans they treat. Like where they were hurt, what doctors have tried to help before, the medicines they have to take, and other important stuff, so that they can be taken care of at other VA hospitals like his. My dad always says every veteran should be able to live a happy, healthy life. Because they risk their lives to protect and serve the United States of America. My dad's a hero to a lot of people, but mostly he's my hero. This is my dad.
Thank you. Hey kids, so who wants to be a doctor? Yeah, you. Tell us why.
Good morning. At the VA, we always start with our customer. We're lucky. We have the best, most inspiring customer in the world, and that is our veterans, those who have taken care of our country and protected all of us. There we go. We also have the best mission and the best set of values in the world. Our mission is very clear, and it comes from President Lincoln's second inaugural address, when he said we need to care for those who have borne the battle, their families and their survivors. President Lincoln's second inaugural address is etched on our building. It's etched on all of our plaques. It's what drives us and inspires us every day. We also have a great set of values, and they form the acronym of I CARE: integrity, commitment, advocacy, respect, and excellence. One of the first things I did when I was nominated by President Obama was I went back and I looked and I said, do we have a good mission? Do we have a good values? And I concluded we did. Did we develop them the right way? We did. We started from the bottom of the organization and we worked our way up. It was a long process, but we got a good mission and good values. The question was, why did that mission and why did those values get violated? Why did the crisis occur? One of the first things I did is I asked every employee in the VA to recommit themselves as a leadership exercise to our mission and to our values, and we will continue to do that every year. Every organization needs to recommit themselves to their mission and values to make sure that they don't lose track of what's really important. This is a model I've developed over my careers in the Army and Procter & Gamble and now at VA. It's a model I use to analyze high-performance organizations and a model I use to build high-performance organizations. This is the model I use to analyze the VA, and I sat down with President Obama, took him through my analysis. I did that in conjunction with our leadership team in order to develop a plan moving forward. As you can see, the lowest level is purpose, values, and principles. As I said, everything starts there. That's the mission, that's the values. Are those solid within the organization? Are people committed to them? The next level is technical competence. If you have a human resource system, is it a good human resource system? For example, you have 4 pillars. It starts with passionate leadership. Then you have sound strategies, robust systems, high performance culture. And if you have all of those things taken together, that forms a high performance organization. This is the organization we want to be in the VA. Let me take you quickly through that analysis, and I won't belabor it, but I will give you some key points. In the purpose, values, and principles area, I thought we had a great mission. I thought we had outstanding values. Unfortunately, the behavior of the organization didn't follow them. You couldn't have people hiding or lacking integrity and still say that you had those values and that they were operational every day. That's why we recommitted ourselves, and that's why we will do that every year. In terms of technical competence, we had misplaced priorities. We were short a number of people. One of my very first trips was to Phoenix. I've been to 147 different VA operations around the country in order to learn and understand what's going on. What I discovered when I landed was we were missing 1,000 providers that we needed on the ground. We had hiring challenges. It took us too long to hire people, too long to accredit them, too long to bring them in. We have the HR system that was broken. I went to our HR leader, I said, give me the 50 top development people in VA, and we couldn't come up with them because HR is unconnected in our organization. In terms of passionate leadership, as I was going out to different sites, I would always have town hall meetings with employees, with the leadership, and with our veteran service organizations and other stakeholders. And what I heard from our employees was they felt like they were members of a system that constrained them and they couldn't change. So I knew I had to change that. Our union leaders felt disenfranchised. We had multiple hierarchies, too many layers, too much middle management complexity. We had 9 different geographic maps, 1 geographic map for every line of business that we had. That complexity made it very difficult for anybody to understand the organization. We have vertical silos. We have the Veterans Health Administration, the Veterans Benefits Administration, National Cemetery Administration. Nowhere do they intersect until you get to the Office of the Secretary. Good customer service organizations push responsibility down in order to get effective decision-making at the interface with the consumer or with the customer. As I was preparing for my Senate confirmation hearing, I went through the publicly available information, and I thought we had some excellent strategies. But when I got into the organization, as I traveled to the 147 different sites I've been to, I discovered that people's behavior and their individual performance plans were not linked back to those strategies. You can have great strategies, but if they're only in a drawer, they're of no value. Those strategies have to be reflected in every single employee's behaviors every single day. They should roll up to the strategies of the organization. Systems. Our systems were bigger impediments to performance than they were helpful to performance. An example is the scheduling system. The scheduling system that was the problem creator or catalyst in Phoenix dates to 1985. When I went to Phoenix, I sat down at the scheduling system myself. It's like operating a blue screen or green screen MS-DOS system. That's unacceptable to have our people work with those kinds of systems. In a high-performance culture, we were overly hierarchical. The leadership was cocooned away from the employees. In fact, one of the things I've done is, as I've gone around to these various sites, is I've talked about good customer service organizations. The VA we want to be is an inverted pyramid. Most people think of hierarchical organizations as a pyramid. You have customers along the bottom. You have a sales organization, which is typically your largest organization that interfaces with the customer, and the CEO or the secretary is on top. That's not the organization we want to be in the VA. We take that pyramid and we turn it on its apex. Across the top are our customers, the veterans. They're the most important people that we serve. The people who then serve those customers should be exalted. They should be trained. They should be paid. What I discovered when I got here is the Office of Personnel Management had downgraded many of our positions that interfaced with the customer because we had descriptions of those positions that were 20 and 30 years old. They were undervalued, whereas those people should be exalted. And of course, at the bottom of that apex, on that apex, is the secretary. And my job is to enable everyone else to treat the customer in the right way. I got frustrated, so one of the things I did in September at my first national press conference was I gave out my cell phone number so every veteran would know who to contact, and also so every employee would know my commitment to customer service. Well, we got the leadership together and we said, what do we want to be? And if you'll notice, the date on this is rather small, but it's 2020. And we talked about what is the kind of agency we want to be in 2020. Actually, we'd like to be this next year, but we've got a lot of work ahead, as you'll see. And this is the kind of agency we wanted to be. We went through an exercise where we closed our eyes, we dreamt a little bit. We said, what is this agency going to look like in 2020? Number one federal agency in the government, great customer service, and we put together a vision for how we're going to achieve that. The number one thing we have to do is put veterans first. One of the things I found in my early days at VA is we were oftentimes too worried about the internal bureaucracy and not worried about veterans. We'd have a veteran pull up to one of our hospitals, not be able to get out of the car because of some injury. They'd call the VA facility in Seattle, and the person would answer and say, rather than going out and helping the person come in, they'd say, call 911 to get to our facility. That's not right. We need to embrace our customers, embrace our veterans, and put veterans first in everything we do. It's the single lens that we look at everything through. The other lens we look at everything through is we've got to be good stewards of taxpayer resources. So those are the two lenses we use. We need to empower employees and help them get all the barriers out of their way so they can provide excellent customer service. A good part of our employees, over 33% of our employees, are veterans themselves, like me. And all of us as veterans want to serve veterans. Well, we've got to enable those people to do that by setting the right strategies, putting in place the right systems, creating the right culture. And we've got to improve our processes. Our processes were broken, and they impeded customer service rather than helping them, the scheduling system being an example. So one of the things we've taken on is to train every single employee in Lean Six Sigma in order to get them involved in the change process, as well as to help give them the tools they need to change the systems that they work with. And last but not least is rethinking our internal structures to become much more veteran-centric and much more productive. We really didn't have a strategy of productivity improvement, and any strong organization has to constantly improve productivity as it improves its service. So what did we do? Well, we first put together a 90-day plan. That 90-day plan led to about the time of Veterans Day, so we called it the Road to Veterans Day. And in the Road to Veterans Day, we have three strategies. Strategy number one was to begin rebuilding trust with veterans and other stakeholders. It's one of the reasons I've gone to 147 different sites, met continuously with veteran service organizations, members of Congress, and others. We had to connect, we had to reaffirm our commitments, and we had to demonstrate that we were holding people accountable. Second, we had to improve service delivery, focusing on veteran outcomes. Today, 97% of our appointments are within the 30 days of the desired date in our health system. 20% are done on the same day. We have more appointments, more health care than we've ever had before. 20%, 22% actually, of our health care is delivered in the community, not in VA. So we're getting people out, we're getting people access to health care. We had to drive down our disability backlog claims. Our backlog, we've driven down over 70%. And we're working to meet the President's goal and our goal of eliminating veteran homelessness by the end of this year. Homelessness is down 33%. But to do all that, we've got to train people in Lean Six Sigma. We've got to renew our strategic plan and tie it to the behaviors of people. We've got to get a better gauge of veteran satisfaction. And last but not least, we've got to set the right course for the long term. That involved a number of strategic studies. The first was the Blueprint for Excellence, which are our 10 strategies to improve our Veterans Health Administration. The other is My VA, which is our blueprint to reorganize VA to put the veteran first. And then last but not least, we had to implement a new bill called the Veterans Access, Choice, and Accountability Act of 2014, which give veterans another way to go in the community for care. That was the first 90 days. That was completed as we got to Veterans Day. Excuse me. The guiding principles of our My VA plan are very simple. Again, look at everything through the lens of the veteran. Second, recognize the central role of VA employees in identifying challenges and also identifying solutions. We've set up over 24 teams across the country of VA employees who are working to change systems. Yesterday, I called one of our employees who came up with the idea of putting one of our reports online rather than publishing it. She saved VA $300,000 every year through that idea. We want to reward that kind of behavior and encourage it, and we worked with our union leadership to empower employees to participate. We have to optimize our unique competencies in healthcare, benefits delivery, and memorial affairs. We have a lot to offer the American public. Did you know that VA invented the nicotine patch, did the first liver transplant, did the first implantable pacemaker, invented the shingles vaccine, has won 3 Nobel Prizes. A VA nurse invented the idea of putting a barcode that can connect patients with medicine with electronic medical records. VA invented the electronic medical record. There's a lot we have that are unique competencies that we've got to bring forward for the American people as well as for veterans. And then, of course, integrating operations to improve service delivery, continuing to improve service delivery, whether it's in VA itself or in the community. And last but not least is focus on the future. We're trying, if I can borrow Jim Collins' words, we're trying to build a clock, not tell time. Build a capability that will outlast all of us. This is what My VA is about. We have 5 strategies. Number 1, we have to improve the veteran experience, and we're working with private sector companies to do that. We're working with Disney, Starbucks, Ritz-Carlton. We also have created an external advisory board that includes individuals like Toby Cosgrove, who was a surgeon in Vietnam and now runs the Cleveland Clinic, or Joe Robles, the past CEO of USAA, USAA being one of the companies with the best customer service, or a fellow named Fred Lee, who wrote a book called If Disney Ran Your Hospital. These are the kinds of people that we're using to help us improve our veteran experience. We're also training our people in design thinking versus analytical thinking. The best customer service companies in the world are trained in design thinking rather than analytical thinking. So we're training all of our employees in order to provide that superior veteran experience. Second, and equally important, is the employee experience. Typically, when a crisis occurs, what organizations do is they stop training. They stop investing in employees. We have put together a program now where we're going to overinvest in employees because we have no hope of improving the veteran experience if we don't improve the employee experience. That's underway. We're now training people in a program we call VA 101, which is a training program designed by employees for employees to improve veteran experience. Third, we have to improve our support services, things like IT, that 1985 scheduling system, and other systems. Right now, for example, we have 14 different websites that require 14 different usernames and passwords. We're going to 1. We have over 900 1-800 numbers. We're going to 1. We have a number of URLs that don't make any sense. eHealthyVet, eBenefits. We're going to something called veterans.com, which makes much more sense. We have to make it easier for the veteran to get in touch with us, not so they don't call my cell phone. I still want them to call me. But we need to make it systemic. We need to build a system that veterans can interact with. Last but not least, strategic partnerships. We have a lot of goodwill in this country. A lot of people want to help. We want to take advantage of that help. So we have 501c3 capability and capability to take advantage of strategic partners. Here are the top 10 initiatives of what we're doing. Some are foundational. Build the veteran experience team. I hired a guy from the private sector who has spent 30 years at McDonald's, was the CEO of the top fast food company in Asia, Tom Allen. He is our Chief Veteran Experience Officer, and he's building an organization. Customer data integration. We want to have one data backbone that includes all of the information on our veterans. Right now, if you change your address as a veteran, you have to contact 9 different agencies in VA to change your address. There's not one data backbone. Number 3, menu of services. We need to make our veterans knowledgeable of all of our benefits and services. We have 9 lines of business. Many times veterans don't know how to navigate that or take advantage of it. Transformational things. Unified digital experience, veterans.gov versus the multiplicity of URLs we have today. The single 1-800 number. One measurement for veteran experience. Right now we have a multiplicity of them. Frontline employee training I talked about, VA 101. Compensation and pension exam. This is the time when a veteran is determined whether or not they get a disability payment or not. It's a very anxious moment in time. We're working to improve that experience for veterans. And community veterans engagement boards. This is critically important. Rather than all decisions integrating at the Office of the Secretary, we're going to create interdisciplinary community veterans engagement boards around the country so VA comes together at a much lower level. Resource decisions can be made at a lower level, and responsibility for customer service can be made at a lower level. We've already have examples of these. We have one in San Diego. We're standing up one in the Northeast right now, which is located in Connecticut. We're going to have 12 of them by July and hundreds by the end of the year. We're building momentum. We started in November. We created a website, an intranet called My Idea House. That's where this lady's idea came from that saved us $300 by putting something online. And now VA employees are contributing thousands of new ideas for how we can improve. We created a My VA task force. In January, we went from 9 different geographic maps, 9 lines of business, all with different geographic maps, to 1 geographic map with 5 districts. Everyone now is coming together around that 1 geographic map. We created a My VA advisory committee that includes people like Toby Cosgrove, Joe Robles, and others that I talked about that are helping us understand the organization we want to be and how to get there. We created a veteran experience officer in Tom Allen. We had our first board meeting in April of the My VA advisory committee. We've created the first community veterans engagement boards. We have more work to do to create hundreds more. We developed VA 101 and launched it, and we have ongoing performance improvements that we're working with employees and other things that we're working on. Full speed ahead. Again, I think we have the most inspiring mission in government. That's to care for those who have borne the battle and their survivors and families. With that mission, I'm sure we will succeed with the values that we have and with the strategic plan we have. Thank you very much for your attention, and I appreciate your attention and your support for our veterans. Thank you.